the age to check your prostate. The prostate is an organ that is influenced through life by the hormones. Men, we produce testosterone, and the prostate has a lot of testosterone receptors. So the influence through the whole life of the testosterone in the gland make this organ is not a static organ. It's a very happens a lot of things inside the prostate, and through life the prostate grows and can cause urinary tract symptoms, and you can develop prostate cancer too. So the age, you have to especially after 45 years old, you have to check your prostate every year. But if you have past family history of prostate cancer, you have to start earlier. In some recent papers, you see that if you are 40 years old and your PSA is under 1, you're not going to have risk to have prostate cancer. But if your PSA is over 1, you have to check your prostate very often. No? And if you have a PSA over 4, having 60 years old, you have to check your prostate very often. So, but if we talk about age, the regular age you have to check your prostate is after 45 years old. And if you have risk, after 40 years old. I'm talking about risk if you have past history of prostate cancer, or you are a special population that has a high prevalence of prostate cancer.
Okay. So is there a test that you can do frequently to see whether or not you getting prostate cancer? Is there a test?
The test, of course, the test you do, the PSA and the digital rectal exam is the test that we do to...
So that's two you mentioned?
Yes.
One is the PSA?
And the digital rectal exam.
Okay.
Is the digital rectal exam is a test that we do in the office. We touch the gland through the rectum. The rectum, the prostate, we touch the prostate in the anterior wall of the rectum, and you can feel if the consistency of the gland. You feel if you have a lump, you have asymmetry in the gland, how hard is the gland. So it is important too, because the most aggressive cancers don't rise the PSA. So that's the reason you have to do both to check your prostate.
This is very interesting, doctor, because I've never heard this before. All I've heard is that you got to do this PSA test and that was it.
No, because like 15% of prostate cancer, the most aggressive, don't rise the PSA. So if you don't do the digital rectal exam, you can miss 15%, and the most aggressive cancers don't rise the PSA levels.
Oh. And that other rectal exam you should also do at age 45 and up?
After age 45, if you see a patient that has a PSA below 1 and the digital rectal exam is normal, you can see that patient in 2 years, every 2 years. You don't have to see it every year. But if that patient has a PSA over 1 and the prostate you see that is bigger for his age, you have to do a more closer follow-up of that patient.
Now, the two tests that you mentioned, you perform these at
Yes.
the St. Martin Medical Center.
We do it. We do it.
Does it take long to?
No. A blood test, you have the results the same day, and the digital rectal exam is a normal examination, part of the physical examination that every patient do in the office.
Yeah.